We are about 4 months out from that surgery. Leslie joins us, as well as spine neurosurgeon Dr. Todd Lanman. How are you feeling, bionic woman?
I'm doing so well. I'm doing really well, and I'm just so grateful to be here after seeing this too. I'm actually, I am, I'm hiking and taking dance classes and going to the gym, and I just am so happy because I couldn't do that for years.
So pretty much symptom-free, the things that were bothering you going in?
Yes, absolutely. And I couldn't believe that after 2 weeks, I didn't need pain medication anymore. I was able to drive and walk around. I mean, after 3 weeks, I was at the gym. It was incredible.
Well, one of the things I love about this, and I told our producer, I'm so glad we're doing this, because truly a great new option as opposed to the typical fusion surgery. And I loved watching your neck flexing and extending and seeing those artificial discs acting like discs.
That's exactly right. And these discs move and they last 70 years. So they don't last 15 or 25 like a knee or a hip.
So sorry, in 70 years, you need another surgery.
70 more good years.
She'll have to come back.
I know, exactly.
So who is a good candidate for something like this?
The patient that we typically see, and I'm one of them actually, I have 4 artificial discs in me, have had neck pain related to a degenerative or herniated disc, and often arm pain as well with the pinched nerve, like Leslie did. And those patients who have failed conservative treatments and so forth often are good candidates and good to be screened for artificial disc replacement. Most surgeons today still recommend fusion.
This fusion, you can no longer move your spine, your back, your neck.
Right.
As previously, I think you have some models here.
Yeah, I could show you this, for example, is a fusion with a plate and screws. This is the traditional surgery we've been doing for 40 years. And you can see that you can't move that at all. Zero, and that's permanent, forever you don't move. Where this is the 2 artificial discs, and these are the same ones that you have in, Leslie. If you watch, these discs move and allow full motion of the spine. And they last forever.
And is it a new thing that you can do 2 levels at the same time now?
Yes, the FDA approved 2-level disc replacement in July of 16, and that's based on the results of this clinical trial.
It is so cool how in surgery we're now learning all these new techniques, new products, because not just, in many ways, I don't want to call this arthritis of the spine because this is a herniated disc, but it is just so cool. And I'm excited to see 20 years from now the kinds of things that you guys are doing. So thank you for profiling this for us. And incidentally, in your clinical trial, the statistics on the disc replacement versus fusion?
Yeah, every parameter was statistically superior with artificial disc replacement. Neck pain scores, arm pain scores, neurologic outcome, overall success, which also measures about 14 other parameters, were all statistically superior. And I think the best thing was revision surgeries, going back and have to redo things, were a third less, 4% versus almost 15% with fusion.
That's significant.
That's huge, and that's a huge cost savings also for not only the patient not having to have another surgery, but the cost of having another operation to the companies and so forth.
And I think Leslie enjoyed the surgery. I don't think she enjoyed watching it.
No, not as much.
But good luck going forward.
Thank you.